And so this is now about 3.5 hours since your single level 360 degrees instrumentation. Are you in much pain?
No.
No?
It's much better, actually.
Yeah, okay. And you're walking, yeah, that's fine.
I can walk.
That's steady, yeah, okay. You feel a bit
dizzy.
dizzy
That's
from...
just because of the pain medication.
Yeah.
I had a banana, so I'm good.
Yeah, that's good. And you're ready to, all changed, ready to go home?
Yes.
Yeah. Any pain in your legs at all?
No, just numb. Just a bit of an ache, but not the nerve pain, not the same.
Okay, that's good.
Not the same.
That's good. Okay, do you want to turn around for us and see how you feel? All right. Do you think you're standing better?
Yes, definitely.
All right, and
this
you...
is actually a lot less painful
Yeah.
than any other posture, so I think I'll stick with this one.
Okay. And that neck pain of yours, you're saying?
It's gone.
Is gone. Right. Okay, it's amazing how a change in posture. Yeah, take it easy. Okay, that's good.